Hello friends, welcome back to Complete Medical Coding. Today let's learn more mock questions and their guidelines. So friends, if you are new to the channel, please support me by subscribing to the channel and please press the bell button so that you will not miss any notifications. Let's discuss the mock questions today. Let's move to the questions one by one. Let's begin with the first question. Patient presents with complaints of blood per rectum for the past 3 months. He has not been experiencing significant abdominal pain, but his bowels have been alternating between constipation and diarrhea. The blood is ribbon-like in appearance. Abdominal exam reveals mild tenderness throughout all quadrants. Proctoscopy is performed with 8 cm of interference. Multiple biopsies are taken. Unable to pass regular scope, stricture size scope was advanced past the lesion and visualized the distal rectal mucosa. Digital exam reveals internal hemorrhoids prolapsing. So this is the diagnosis. Okay, internal hemorrhoids. Biopsies sent to lab. Patient scheduled for follow-up visit pending pathology report. What CPT and ICD-10-CM codes are reported? So here initially they are explaining how the procedure is being done and what are the complaints of the patient. Okay, patient is having blood per rectum, it means hemorrhoids, since 3 months, and he doesn't have any abdominal pain, but he's having constipation and diarrhea on and off, like it comes and goes like that. Sometimes constipation, sometimes diarrhea. Then an abdominal exam has been done, which reveals mild tenderness. Okay. Proctoscopy is also performed. Biopsies are taken. So, here the procedure is biopsy. Biopsy is taken. So, biopsy is the procedure here. And then what is the diagnosis? Internal hemorrhoids. Only one diagnosis is there, which is clearly mentioned in the second last sentence. Digital exam reveals internal hemorrhoids prolapsing. So, it means internal hemorrhoids is the diagnosis. Okay. So, let's check the diagnosis codes one by one. What is the first diagnosis? K64.1. What is K64.1? Just open your ICD code book and go to K64.1. What is K64.1? It shows second degree hemorrhoids. In our question, nothing is mentioned about the degree, the extent of the hemorrhoids, right? It's not mentioned about first degree or second degree like that. Just mentioned internal hemorrhoids. So we can't code second degree hemorrhoids. So what will be the ICD code? What is the next ICD code in the option? K64.8 in option B. K64.8. What is K64.8? Other hemorrhoids. We can code that, right? Because since it's not mentioned the degree of hemorrhoids, you can code other hemorrhoids. What is the next ICD code in option B? K62.5. What is K62.5? Hemorrhage of anus and rectum. That is same. Other hemorrhoids, we cannot code both together because in option B, two ICD codes are present, K64.8 and K62.5. Both are actually same. So, no need to mention both. Both are same. So, you cannot code both together. Okay, you should code either K64.8 or K62.5. But K64.8 is more accurate since it is mentioned as other hemorrhoids. Anyway, what is the next code in option C? Same, K64.8. Only that one we have to code. What is in option D? K64.4. K64.4 represents residual hemorrhoid skin tags. This is not a skin tag. So, you got the exact ICD code as K64.8. Only that one. You cannot code both with the same description together. So K64.8 is the answer, correct ICD code. So you can conclude that option C will be the correct answer, right? Because in other options the ICD codes are incorrect. So what will be the procedure? Just check the procedure also if it is correct or not. 46606. What is 46606 CPT code? Anoscopy with biopsy, single or multiple. Yes, biopsy is the procedure here. So that CPT code is correct, 46606. Anoscopy. Okay, because proctoscopy is mentioned in the question. Proctoscopy and multiple biopsies are taken. So anoscopy with biopsy, single or multiple. So this is the correct procedure code. So which makes our answer as option C, 46606, and ICD code as K64.8. Okay. Let's move to the second question. A VBAC is performed on a 30-year-old woman who received routine OB care for 9 office visits from physician A and postpartum care and delivery from physician B from a different practice. What would be the correct CPT codes for physician B's services? What is VBAC? Vaginal birth after cesarean. Okay. So here the question looks so easy, but the answer will be little confusing. If you go through all the CPT codes, the answer will be little confusing. So you have to understand what exactly is mentioned in the question. Okay. So here there are two physicians, physician A and physician B. What does physician A do? Under physician A, this patient has received all the routine obstetric care up to 9 office visits. Up to 9 office visits means almost all the office visits, OP visits are completed, right? And then from physician B, this patient had done postpartum care and delivery. Okay, so postpartum care and delivery has been done by physician B, under physician B. That is from a totally different practice, totally from a different hospital setting. So what will be the correct CPT codes for physician B service? We have to code for the only for the physician B service. It means only for the postpartum care and delivery. Okay. So you have to code for postpartum delivery, and this delivery is being done through VBAC. Okay, it means vaginal birth after cesarean, means vaginal birth after the previous cesarean delivery. So let's find out the answer. Go to the first option, 59614. First CPT code. What is 59614? 59614 means it represents surgical procedure for maternity care and delivery procedures after previous cesarean delivery. This can be a right answer. Here the description is correct, right? Surgical procedure for maternity care and delivery, okay, after previous cesarean delivery. What is in option B? 59610. If you go to 59610, see, 59610 represents routine obstetric care including antepartum care, vaginal delivery with or without episiotomy or forceps, and postpartum care after previous cesarean delivery. So this also, you will think that this can be also coded, but just read the description once again. Routine obstetric care including antepartum care, vaginal delivery. Yes, this is vaginal delivery only, but here it's mentioned including antepartum care and postpartum care. So it means here this code description is not only postpartum care but also antepartum care. So here physician A's service is also mentioned here in this code, right? Antepartum care. But we don't have to code for the antepartum care. We have to code only for the postpartum and the delivery. Okay. So you cannot code this. That's why I have told you initially, when you read the question, you will find that you will come to know that it is easy but little confusing. You just have to read and understand the question. What is in option C? 59426. What is code 59426? 59426 again, vaginal delivery, antepartum and postpartum care. No, we cannot code antepartum here. What is 59400 in option D? Again, it comes antepartum and postpartum. 59400 routine obstetric care including antepartum care, vaginal delivery and postpartum. No, so wherever antepartum is mentioned, you cannot code that. Okay, so our correct CPT code is 59614, which is option A. Okay, 59614. The surgical procedures for maternity care and delivery. Here, postpartum care means maternity care. Okay, that is not maternity care does not represent the antepartum care. Antepartum is different, maternity care is different. Maternity care means postpartum care. So surgical procedures for maternity care and delivery procedures after previous cesarean delivery. So the correct answer is option A, CPT code 59614. Okay. Now let's go to the third question. A pregnant patient delivers diamniotic dichorionic twins at 30 weeks gestation. The first baby is delivered vaginally, but during this delivery, the second baby turned into the transverse position during labor. The decision is made to perform a cesarean to deliver the second baby. Both babies are healthy. The physician performing the deliveries also performed the prenatal and postpartum care. Code the procedure and diagnosis codes. This is an important question, so you have to you have to read the question carefully and understand what is mentioned in the question. So here, it's a delivery of a twins, right? So during the patient is 30 weeks gestation. So the first baby is delivered vaginally, okay? But during the first delivery, what happened? The second baby is turned into the transverse position so that normal delivery is not possible. So the second baby has been delivered through C-section, cesarean delivery. But nothing happened to both the babies. Both the babies are healthy. Okay. Physician also performed prenatal and postpartum care. So let's look into the diagnosis codes one by one. Go to the first diagnosis code O32.2. O32. What is O32.2 XX2? O32.2 represents maternal care for transverse and oblique lie. Transverse position, yes. During the first delivery, the second baby has been turned into transverse position, right? So this code should be included. That is why it is mentioned here, O32 point. We are just looking into the code O32.2 in the ICD code, okay? Which represents maternal care for transverse and oblique lie. What is this XX2 represents? XX is the placeholder because there is no alphabet, so it will be representing as a placeholder. What does this last 2 represents? That represents the second baby, okay, because second baby is turned into transverse position. That is why after the XX, it's mentioned number 2. If it is a first baby who has been turned into transverse, then the code will be O32.2XX1, okay. Here, since it's a second baby which is turned into transverse position, we will code it as, we'll put the number as 2. So, O32.2XX2, that is the correct CPT code. Now, what is the next one? O30.043. O30.043. O30.043 represents twin pregnancy, dichorionic, diamniotic. Yeah, it's mentioned in the question, diamniotic, dichorionic, because it's a twin pregnancy. So, it will be a diamniotic and dichorionic pregnancy. So, O30.043 represents twin pregnancy, dichorionic, diamniotic, third trimester. Since it's a 30 weeks, this is third trimester. Third trimester starts from 28 weeks, okay. So, this code also should be included because it's a twin pregnancy. So, what all things we have to code? We have to code twin pregnancy, we have to code the number of gestation, we have to code the transverse position because second baby has turned transverse. Then we have to code the delivery, first delivery vaginally and second delivery cesarean. Okay, all these codes should be included in the answer. Now, what is option C? Sorry, what is the third ICD code in option A? O60.14x2. What is O60? Just take O60.14x2. Since this is 30 weeks gestation, this is a preterm. The babies born before 36 weeks are considered as preterm babies. No matter the baby is healthy or what, before 36 weeks, we will consider it as a preterm labor. So, since this is a preterm labor, you have to code the preterm code also. Okay, so O60.14. O60.14 represents O60.14. Preterm labor, third trimester with a preterm delivery, third trimester. Yes. But here 14x2 means second baby. Since this is a twins, second baby only is coded here as preterm. What about the first one, 14x1? That also should be coded, right? Because this is a twin pregnancy, you have to code 14x1 also for the first baby. Here 14x2 is mentioned in this option. This is only for second baby. So go to option B. In option B, the same ICD codes as mentioned in option A, O32.2xx2, O30.043, and then C, O60.14x1, O60.14x2. These both should be coded because it's a preterm labor. For the first, since it's a twin pregnancy, you have to code O60.14x1 and O60.14x2. Okay, for the first baby and second baby. And then what is ICD code Z37.2? Z37.2 represents twins. Twins, live, both live born. Okay. Twin pregnancy and both are live born. That also should be included. That ICD also. I forgot to mention it earlier. You have to code O code first along with the C code, right? So Z code, number of weeks. The next code Z3A.30 represents 30 weeks gestation that you have to code. Along with that, you have to always code for if it is a live born or a stillbirth. Okay, that is important. When you are coding pregnancy codes or delivery codes, you have to always code for the live born. Okay, so here since this is twins, Z37.2, twins, both live born. That's why it's mentioned in the question. Since it's mentioned both babies are healthy, so you have to code Z if it is live born. If that, just imagine if that option is not mentioned about babies if healthy or live or whatever it is, then it's not necessary to code that. Okay, but here we have to code because it's mentioned there both babies are healthy. So Z37.2. Okay, so these are the ICD codes that you have to code. The first one represents transverse labor. Second one represents O30.043. Twin pregnancy, diamniotic dichorionic. And then you have to code for preterm labor for the first baby and second baby. O60.14x1 and 14x2. Then Z codes you have to code 30 weeks pregnancy and then Z37.2 live twins live born. Okay, so these are the ICD codes. Now we have to code for the procedure. First is vaginal delivery and second is cesarean delivery. So go to CPT code in option B. Anyway, option A is not correct. So go to option B, 59510. What is 59510? Cesarean delivery. Cesarean delivery. And then what is 59409? Vaginal delivery. You have to always code for the severity first. Okay, that is why here cesarean code is mentioned in the beginning, 59510. Because you know that cesarean delivery is the major procedure than the vaginal delivery. So you have to code for the cesarean delivery first, 59510. And then 59409, which represents vaginal delivery. Okay, 59409, vaginal delivery only. Then we are appending the modifier 51. We are appending the modifier 51 to the CPT code 59409. 409 because it's a multiple procedure. Okay, this is a multiple procedure, right? Twin pregnancy, and it is not a same procedure because both are delivered. One is delivered vaginally and one is delivered cesarean. So it's a different procedure, multiple procedure. So you have to append the modifier 51 into the, don't put modifier 51 in the first code, primary code. You have to always put it code. You have to always mark the modifier in the secondary other than primary code. Okay, don't append modifier into the primary procedure. So 59409 with modifier 51. So our correct answer is option B. Okay, just go through this description once again and just go through whatever I have mentioned. Then you will understand it again. If you read carefully, like more than 1 or 2 times, you will come to know the correct answer. Okay, if you want, you can just go through the other options, CPT codes and ICD, but it will not be the correct answer. Like few codes are missing in other 2 options. So correct answer is option B. Cesarean delivery, vaginal delivery with modifier 51, which represents multiple procedure. Then ICD codes, okay, for both twins. O codes and then Z codes. Okay. Now let's go to the 4th question. A 6-week-old infant has hydrocephalus and the parents have consented to have surgery to drain the cerebrospinal fluid, CSF, short form for cerebrospinal fluid. The infant's scalp is incised and a burr hole is drilled. So here the procedure is to have a surgery to drain CSF. Okay. Now how the procedure is being carried out, that is what is mentioning here. Infant's scalp is incised and a burr hole is drilled. A catheter is inserted through the brain tissue into the enlarged lateral ventricle. A valve is attached to the ventricular catheter. A periumbilical incision is made, dissecting through until the peritoneum is identified and incised. The shunt is tunneled, passing over from the belly up to the cranial incision with a small counter incision in the neck. The shunt tubing is passed through and then cut and attached to the strata valve. Free flow of CSF is obtained from the distal shunt tubing and is placed into the peritoneum. What code is reported for this procedure? So here, what is the diagnosis? The patient is having hydrocephalus. Anyway, we don't have to code for the diagnosis. In the question, it's asking only the CPT code. So what procedure is being done here? Surgery to drain cerebrospinal fluid. How it is done? Through a burr hole drilled and catheter is inserted. Shunt is tunneled. Everything is mentioned. The procedure is mentioned in the question. Okay. So let's go to the options one by one. What is option A? 61070. 61070 represents injection, drainage or aspiration procedures on the skull. This is not injection, so just leave that. What is option B? 61210. 61210 is a twist drill, burr hole or trephine procedures. Ventricular catheter, reservoir, EV electrodes, pressure recording device or other cerebral monitoring device is placed through the burr hole following aspiration of the hemistoma. Let's go to the other options. 62192. What is 62192? 62192 is creation of shunt, subarachnoid or subdural peritoneal pleural other terminus. Creation of shunt. And what is in option D? 62223? Again, creation of ventriculoperitoneal shunt. That is what we need to code, right? Because see, shunt is, distal shunt tubing is placed into the peritoneum. So this is the correct CPT code. Creation of ventriculoperitoneal shunt. So which makes the answer as option D, 62223. Okay. Let's move to the 5th question. A patient presents to the emergency department suffering from an acute exacerbation of his asthma. The emergency department physician performs an expanded problem-focused history. The physician documents a detailed 6-organ exam. Medical decision making of moderate complexity is performed and includes ordering a chest X-ray and providing a prescription for an inhaler to be used every 2 hours. What emergency department E&M code level is reported? So here we have to code for the E&M code, okay, evaluation and management code. So since it's an E&M code, what is mentioned here? What are the 3 key components that is mentioned here? This is an emergency department code. Then physician documents performs expanded problem focused history. So first is expanded problem focused history. Second is detailed 6-organ exam. Okay, detailed examination and medical decision making of moderate complexity. So expanded problem focused history, detailed 6-organ exam means you can consider that as expanded examination and moderate complexity. That code we have to find out. So go to the first code, first option, 99282. What is option 99? What is code 99282? It's emergency department visit for evaluation management of the patient, which requires 3 key components: expanded problem focused history, expanded problem focused examination, and medical decision making is of low complexity. We need medical decision making of moderate complexity, right? So go to the next code 99283. Here same emergency department visit for E&M evaluation and management of the patient, which requires 3 key components: expanded problem focused history, expanded problem focused examination, and medical decision making is of moderate complexity. This one we need. Still look into the other 2 codes 99284. Here the 3 key components are detailed history, detailed examination, and medical decision making of moderate complexity. No, at least 2 key components has to match. So here only one is matching, medical decision making of moderate complexity. Now what is 99285? That represents a comprehensive history, comprehensive examination, and medical decision making of high complexity. So that is also not the answer. So the correct answer is option B, CPT code 99283, emergency department code for E&M of the patient, which requires expanded problem focused history, expanded problem focused examination, and medical decision making of moderate complexity. Okay, so the answer is option B, 99283. So friends, these are 2 important questions from the CPC examination. If you like the video, please like and share, and please support me by subscribing to my channel, and please press the bell icon, okay, so that you will not miss any notifications when new videos are getting uploaded. If you have any queries or clarifications, you can mark it in the comments. Okay friends, so stay tuned for more videos and more questions. Thank you so much. Bye, take care.